for the Health and Human Service / Policy and Legislation Committee meeting in person. Call to order. Okay, so we're gonna do introduction. My name is Marilyn Pena. I am the chairperson for the Health and Human Service Committee.
My name is Duani. I am chair for Bylaws, Policy, and Legislation.
I'm Whitney Williams. I'm a board member.
Sam Rivera, On Point NYC.
Jason Beltres, On Point NYC.
Claudia Rathbone, community board member.
Emma Alexander, St. Anne's Corner Harm Reduction.
Crystal Montalvo, St. Anne's Corner Harm Reduction.
Watuke, Ini Inaru, board member.
Yeah.
I'm Addie. I'm just a resident.
You are not just a resident, you are the resident.
Hi, I'm Jose Quintana at the New York City Department of Health at the Bronx Neighborhood Health Action Center.
I am Ariane Saxon with the Paxton Network.
On Point.
Tony Smith for Policy Alliance.
Ms. Flemsing, On Point.
Randy Munoz, On Point.
Mara Pass, Mount Haven Herald.
Marina Samuel, Mount Haven Herald.
Kenneth Johnson, Health Department Community Affairs.
Stephen Palmer's Community Coordinator, Bronx City 1.
Good evening, ladies and gentlemen, Madam Chairs. I'm Edwin Jordan, District Manager to the board. I want to remind everyone that our meetings are broadcast live on our social media platforms and our YouTube channel. Please silence or vibrate all electronic devices. Please speak clear and concisely when you are talking so our recording devices can pick it up. Thank you, Madam Chairs.
Okay. New businesses? Anyone here for new businesses? Okay, so we're gonna do the On Point. We're gonna have Sam Rivera, Executive Director for On Point NYC, to present.
So I wanted to know if you wanted to ask questions, like how did you want, because I could go on maybe way too long, but I know we had some questions you guys sent not too long ago. Maybe that's a good place to start.
So
Yes.
Mayor, Health and Human Service Marilyn was in our last presentation. We had a great detailed presentation from your street outreach team. And we knew that you guys were going to come here and have more like specific details and policy. So I just want to just set the tone for even St. Anne's. I know you guys have a presentation shortly thereafter. Is that there's been a lot of discussion about open drug use in the Bronx. We learned that it's one of the cheapest boroughs to get drugs and some of those issues. We don't really know what the solution is, so this is just all exploratory. We know that safe injection sites, we wanted to learn more about them. Obviously, Manhattan has the only two in the 5 boroughs, and whether something like that would be of interest to the residents of the Bronx, so we wanted to gather information. We did learn about the street outreach team that does exist here. We also discussed that we know that it's going to be a big obstacle to even have a safe injection site in the Bronx, given that Hochul has taken a position that no opioid crisis, opiate settlement money can go to safe injection sites. Some of the concerns of the community that we hear is that we have a lot of drug clinics, whether that's methadone, Suboxone, and things of that nature already. And we think there's a belief, no evidence to support, but that an oversaturation of these facilities is also causing the group of these type of individual with these medical conditions to really centralize in the hub. And so there is a pushback if we need an additional drug treatment facility, and we would put under drug treatment facility a safe injection, because we know that the facility also does, if people are willing, disperses Suboxone and things of that nature. So we knew that you as a policy person may have more details about some of the pushback, criticism, highs and lows of having that facility, having such a facility in your borough. And that's the purpose of this, just all exploratory. So hopefully we could present, an option to our community board members and see if that's something they're willing to take, because there's a lot of discussion about the problem.
Well, that helps.
Yeah.
Thank you. So the first thing I'll say is we provide a certain service out here in the Bronx. Right? We're primarily located. Our brick and mortar locations are in Manhattan. And we have the only 2 overdose prevention centers. We don't call them injection sites for a variety of reasons. One is people shy away from that language, and it has a negative effect on communities. But the most important reason why we don't call them safe injection sites is because they're not. They're polymodalities. So people use an array of drugs in these sites. So, and you'll probably find that my team should correct me if I'm wrong. I'm always happy to be corrected. What we find specifically as an example, and I would think the Bronx is similar to East Harlem, is we have a lot of folks who smoke, older population of people who smoke. I would think the Bronx has a combination. I think the Bronx would look like Washington Heights and East Harlem sort of mixed. So I would think if you opened an OPC in this area, you would have a decent sized smoke room with the opportunity for people to inject and inhale drugs as well. The second thing I want to say is there are other providers here, right, who are located in the Bronx, which is why you probably hear from our team often saying we can provide services. If there were an opportunity to open an overdose prevention center, it wouldn't likely be on point. It would likely be another provider who's local. Again, it also depends on the organization. We have a few here today. So I'll talk about, I'll answer some of the questions you asked or some of the points you made. On the policy side, I actually asked Tony Smith from Drug Policy Alliance to come, who's here, because one of the things we realized in our work is most harm reduction organizations are not only direct service, but they also have a policy arm and an advocacy arm. We're blessed to work closely with Drug Policy Alliance so that we can focus more on the service aspect of what we do and then lean on them for the policy side. So first, we run the only 2 overdose prevention centers, not only in New York, but in the country. Right? And so we look at what does that mean? And again, I would ask you, because if this is what you were saying, is to figure out a way to separate an overdose prevention center from any treatment or even if it's MAT treatment, any recovery or treatment center, because it is a very different service. And although oftentimes our work leans into opportunities for people to reduce their use or no longer use, and also get into some level of recovery, there is a separation and there is a very big difference. We would love some of our partners, and we would love their budgets if they're willing to work on that level of it. So the answer is right now, in the current state we're in what's happening across this nation, the answer is OPCs. I mean, I don't think that's debatable. I mean, people could try to debate, and I'll be happy to join anyone on a debate on that. For a number of reasons. We have the most tainted drug supply we've ever had in this country. We have the words a war on drugs, which isn't true. There's a war on drug users, specific drug users, black, brown, and poor whites. For us in New York City, it's about black and brown people. And we have a situation where specific drugs are allowed to enter specific neighborhoods. People in those neighborhoods use and sell those drugs and are punished for doing so. And unfortunately, many of us who provide services in these neighborhoods participate in that punitive part of the work. We hold our own people accountable in a way, supporting the nonsense of the government, wanting to basically put all our people away and not provide the service they need as they need it. So what an OPC brings to a neighborhood like this, or any neighborhood in need, is an opportunity to understand that people are using drugs anyway. The folks we work with are already deep in their drug use, right? And what we want to do is be there for them to provide the epitome of when people say we meet people where they're at, we meet them where they are. Harm reduction is the epitome of that, because it is the most open and non-judgmental approach to addressing folks who use drugs. As you notice, you won't hear me say they're addicted to drugs or they have a disease. We're talking about people who use drugs. We're not going to get that deep in the woods, in the weeds with this, right? The need is here. I mean, I just wrote a couple of things you said. The need is here. The need is clear. Our team has been talking about it for years. This isn't new for the Bronx. Satcher has been doing this for many, many years, knowing there's an issue here. There have been multiple attempts to open overdose prevention centers before us. We don't talk about On Point being the first in that wave because we were just ready, right? So many organizations have the ability to operate overdose prevention centers, and there are a variety of reasons why they don't happen. Oftentimes, it's the space you're located in, other mitigating factors, not necessarily the organization. It's just the ability to do it. Satcher right now has had, I won't speak for you guys, but has had a mock setup for years, and they're just not allowed for a variety of reasons. They could talk about why, to operate them, even before we had ours built out. So we have to, those are the things to look at as well. On the political side, and Tony Smith can talk about this more, is and I'm glad you mentioned this, we're in a state where the governor is taking credit or oftentimes feeling good about being recognized as having the only 2 overdose prevention centers in the country, and at the same time saying, but we won't fund you or even recognize you.
Mhm.
And what we say to that is every 90 minutes, and the time we're done with this meeting, a New Yorker dies, and it's unacceptable. And in the time we're spending talking about this, New Yorkers are dying and continues to die, and it's not getting better. The other thing I'll ask Tony to get into is we're hearing this new thing that there's a reduction in overdose death in New York State. Yes, it's true, but not true for Black and brown folks. In fact, our numbers are going up. So we have to watch that language, right? I'm a linguist, so I don't let people get away with that kind of stuff and say things like, hey, the numbers are going down. Isn't this great? Whose numbers are going down, right? Who are you impacting? We also have a community that many of our Spanish-speaking folks don't identify with who we really are. They consider themselves Hispanic. They consider themselves, what's the other one, Latino. And if you're a person, and I'm looking at my sister right here, if you're a person from the Caribbean, where most of us are from, we're neither. We are Tainos, and we're not leaning into that enough, right? We're not. And it's important, the reason why I bring that up quickly, it's important because there's an opportunity to address that, to address our population through maybe some other federal needs if we identified ourselves for who we are as folks who are eligible for federal funding as Taino people. So I want to stay on track. Is it fit? Yes, it's a fit.
I just want to add,
Sure, please jump in.
Just to help direct the conversation, I know there's a few people you've noted that will jump in, is that, to be specific, the problem is visibility, okay? And the people don't want to see the drug users, you know, and they find them to be undesirable and that it to be a problem. And it is I'm a public defender, and it's there, you know, we want to make sure that problem is not resolved with the police.
Yes.
However, I've done some research, and like I spoke to Parks, the park person near the Heights location for your facility. We also know that even though you can provide a space, some of that space is limited, right? The building can only fit but so many people. Right. We learned at our last presentation, there are people who will not use the facility even though it is available. That is their autonomy to do so. And so we noticed that it was noted that people are still in the parks, okay? And there's a huge problem in St. Mary's Parks. You guys know, you guys do some syringe collection in St. Mary's Parks, and you know, it's a huge issue, which then fuels the war on the drug users, right? And so we're trying to see, you know, which is beyond us, but things that decrease visibility in a safe way, so that the war on the drug users doesn't happen, even though I think there's already discussion on that. So I wanted to make sure that's clear.
Perfect. Thank you for that. So I'll hit a couple of points and then ask other people to jump in. So I'll give you a few examples. We opened November 2021, the last November 31st, 2021. Prior to that, our team, we worked with Highbridge Park and the Parks Department. We were averaging, the team and Parks Department was averaging collecting 13,000 syringes a month from the park.
In the
13,000.
Yeah.
Highbridge. These guys in that team. 13,000 syringes a month. We open November. December report comes out. We get a phone call. It actually was filmed during a documentary, which is pretty great that it happened. Kaylin C., who was our senior director of programs, and gets a phone call. One of you guys got a call. It got down to us. And the question for the Parks Department was like, what happened? Something's wrong. Either you hired more people, something is off. 13,000 syringes in a month became 1,000. That's what an OPC does. In a month. That number's down to hundreds now. I mean, you guys can talk about that. That's the impact of an OPC within a month, right? Across the street from the park. That same park has a children's playground that's been closed for years. Closed because, again, according to the Parks Department, drug users. That summer, that park reopened, the children's playground. And one of the blessings for us was to walk staff over to the window and point them to the park and say, see all those kids playing in there, and the sprinklers were on. That's because of the work you guys are doing, right? So I'm blessed to have the staff that does this work. So now I want to talk about some numbers and the impact. And I remember our first meeting with community after we opened, and I have no problem being very transparent. We didn't open with a ribbon cutting. We didn't have a party to say we were opening, and specifically why is because people would have probably asked us not to. And we knew it was the right thing to do. We opened, we made a short announcement, and we opened and made it happen. We had a meeting with the community board, of course. They were like, you did this without us, and I'm very upset. And we understood and respected that. During our meeting, I realized a point that was very important, and I'll say this to you too. What we did for the community is we responded to their request. Now they said, no, we didn't ask you to open an OPC. We didn't want that. I said, no, you said you didn't want public drug use. You didn't want paraphernalia in the parks and schools. You didn't want kids looking at people using drugs in the street. You didn't want people dying in your alleys and in your bathrooms and in restaurants, etc. We agreed with you. The problem is most of our people want the people gone. We responded by opening our doors and having more people come in. So now I want to talk about the outcomes of that. Since we opened, less than 3 years, it'll be 3 years this November. Since we opened, we've had over 165,000 utilizations. That means 165,000 times people that would have used in the street used inside with us. So can you imagine the community you're talking about? Let's reduce in 3 years 165,000 utilizations. That's impactful, right? Because all that public drug use, you're right, doesn't totally go away, but it goes down by 165,000. That's huge. The number of deaths in those communities and in those parks and in those streets, extremely down below to the number of in the 90 percentile, right? The amount of paraphernalia, almost 5 million units of hazardous waste collected by both our outreach and public safety team and collected internally in our overdose prevention centers, because when you use with us, none of that paraphernalia leaves the building. So again, in less than 3 years, almost 5 million units of hazardous waste collected and disposed of safely. That means kids didn't see them in the parks like they were before, all of that, right? In New York City, we estimate, and I'm sure it's a lot higher because no one's debated me yet on this, and I've been saying it for 3 years. We estimate that the response for New York City, the cost of an overdose response in New York City is roughly $30,000 every time someone overdoses. Between the police, EMS, possibly the fire department, the fentanyl task force, everyone who shows up. The person that gets moved to a hospital, that person has to be in the hospital for at least 3 hours in observation and many other things that might happen. While they're in the ER, they address other ailments as well. So estimate 30,000. We've had over 1,650 overdose interventions, 1,650 times. Of those 1,650 times, we've called an ambulance about 100 times. And they weren't to support with the overdose. There were other issues we were concerned about, high blood pressure, heart issues, etc. So we remove 100 from the 1,650. We have 1,550 times $30,000. In 3 years, we saved just 2 New York City communities. Small, East Harlem, very specific, Washington Heights, over $45 million. What community says no to that? It's almost impossible to say no to that. Not only are you addressing the issue for the human beings, the beautiful people who we love in our community, who are using our services, you save the community money, you impact you reduce the impact on the emergency room so that folks who are bringing their children in or their sick elders into the emergency room have access, and so on and so on. So I think that's one really good way to look at what it can do for your community, what it can do for people who disagree. And believe me, we tell people when people disagree, we know that it sounds radical. It sounds like, why are you letting people use? Because if there are people who do this work and believe that they are so amazing at their job that they can stop someone from using drugs, they themselves need to check up from the neck up because it's impossible. But we know at On Point and other harm reduction organizations, is people reduce their use and sometimes stop using because of other services that are involved. And the team could talk about what those are. I'm sure they've told you. So someone comes in to use the OPC, they end up in our seeing a doctor or a nurse in our program. They start to feel a little better. They might participate in our holistic health program and get acupuncture and acupressure and sound therapy.
And it's open to the public.
And it's open to the public. All of our services are open to the public. As someone who comes in and enjoys our services, and all of these services are free. So what happens in a community when you include a harm reduction organization that has an array of services? When we were doing vaccines, public, we're in the process of opening a number of additional services like a barbershop and a salon. We're going to allow the public to use that as well, right? Et cetera, et cetera. So I feel like I've been talking too long. I just want to be able to give you that.
Oh, no, that was great context. I don't know what our time is. I know there's other people you called in, and I know I call them St. Anne's Harm Reduction. What do you call them, Satcher?
Yes.
Oh, sorry. I don't know the names. Sorry, the acronym. I don't know. St. Anne's should do their presentation first, and then we can have just a community conversation with all the other providers. I know Drug and Policy Alliance is in the room as well. Presentation.
Yeah, sure.
Yeah.
I know you all have your slides in front of you.
We're gonna bring it up on the system.
Oh, perfect.
So, good evening.
Yourself for the record, please.
Good evening, everyone. My name is Crystal Montalvo. I'm the co-director of programming for St. Anne's Corner of Harm Reduction.
And my name is Emery Alexander. I am Outreach and Women's Services Manager at St. Anne's Corner of Harm Reduction.
Thank you.
So, St. Anne's Corner of Harm Reduction has been around for 34 years now. We're making 34 years this year. We actually started in Community Board 1 at the corner of St. Anne's Avenue and 139th Street. Currently, we're located at 886 Westchester Avenue. Our brick and mortar is in CB2. However, we still do the bulk of our outreach in CB1. And we are still at the corner where we began, where Joyce, our CEO and founder, began syringe exchange from the trunk of our car. These are just some highlights from the last quarter. This presentation for you guys is from the last quarter of services that we've provided in CB1. So some notable things. On average, we see about 100 people a day in and out, sometimes more. We give meals, we give breakfast, lunch, and dinner. As you can see, we're open from 6 a.m. to 12 a.m., which is relatively new. We're looking to expand that further in the upcoming months, given staffing and things like that. We provide wraparound services that is breakfast, lunch, and dinner, 2 snacks a day. Folks can come in. Unfortunately, we aren't open to the public for various reasons that I will get into. But we have a women's service unit, a drug user health hub, a syringe access program. We have holistic health services, our outreach team, and newly introduced, we do drug checking at our agency. So we're here to talk a little bit more about our outreach services in the community as it pertains to you guys. So I'm going to hand it over to Emery.
You can go to the next slide. So this is a picture of us on 147th and Willis at the Bronx Opioid Collective Health and Resource Fair that we organized with the Bronx Opioid Collective. Shout out to Acacia Network and On Point that were also at that fair back in June of this year. We can go to the next slide. This is just a map of our outreach scope within this district. So the blue outline is where we conduct our syringe outreach response. So that is when we're responding to ground syringes. As you can see, we are all throughout the district. And then the pink points are where we have our street outreach sites, which is what I'll get into in a few minutes. If you can go to the next slide. These are our syringe outreach response team outcomes for the last quarter. We conducted 57 syringe outreach response cleanup events in this district between the months of July and September 2024. In those 57 events, we collected just under 9,000 ground syringes from this district. We regularly clean through 3 NYCHA housing grounds, and we canvass 3 parks regularly in this district. You can go to the next slide.
Which includes St. Mary's.
Yes, including St. Mary's. In the springtime, we were working with the Assembly members' office to organize the Friends of St. Mary's Park. I know that some of the board members were joining us on those efforts as well. We have been in contact with the Assembly members' office, and we are trying to get this group back up and running in the fall. So these are some pictures from those events as well. These were community-wide events, so the community was working to respond to trash litter while we were responding to the hazardous waste such as needles and a lot of glass in St. Mary's Park as well. So we did a cleanup with some of the local schools, and we were responding to the glass and the needles that they came across. And then during the Saturday morning community cleanups, we were responding to the needles. We can go to the next slide. So that's for our syringe outreach response. That's when we're responding to the ground syringes. And then this next portion is our mobile outreach types. So we have 3 locations where we conduct mobile outreach in Community Board 1, and we conduct 2 types of mobile outreach in this district. The first is peer delivered syringe exchange. So this is on Wednesday afternoons. We are on 149th Street near Brook Avenue, near AutoZone and Burger King. The PDSE events, which stands for the peer delivered syringe exchange, takes place out of our mobile unit, which is currently a Sprinter van. Participants are able to access safer supplies, prevention items like alcohol pads, sterile water, wound care counseling and direct service, as well as rapid HIV and hepatitis C testing and meals when we have the capacity to do so. We also conduct 3 stateside street outreach events at 2 locations. First is East 139th Street and St. Anne's Avenue. As Crystal mentioned, that is our home. That is where our organization was first started in 1990, and we still do outreach there twice a week. On Tuesdays, we are there from between 10 and 11 a.m. to 2 p.m., and then Fridays between 4 and 6:30 p.m. We are also at the corner of 148th Street and Bergen Avenue on Fridays from 11:30 to 2:30. Street outreach sets up a table and a tent. So if you are walking through that area, you've probably run into some of our outreach team members while we're out there. We offer full wraparound services, including supportive and preventative counseling. And within the last quarter, we have started to bring our low threshold buprenorphine clinic to the street at East 139th Street and St. Anne's Avenue. So our medical provider, which is a medical doctor, as well as several of our medical staff members from our Drug User Health Hub, go out to the street and they start folks on buprenorphine, as well as continue maintenance for folks that are interested in that.
I'm so sorry. What is buprenorphine?
Buprenorphine is a medication for opioid use disorder. So it's
like a Suboxone.
Yes, exactly. Suboxone is the most common name brand. However, that isn't always what folks need. So buprenorphine is the medication. So it's kind of like Tylenol and acetaminophen. Like buprenorphine is the name of the medication, and Suboxone is the brand name.
Okay. And you only give it to people who are willing?
Yeah, folks that are interested in it. So we offer the information and the counseling to everyone, and we let them know the doctor's here right now. If you're ready to get started, we're ready to get started with you. The doctor will walk them through what it will feel like to start the medication. And in addition to the buprenorphine prescription, the doctor does offer comfort meds as well, because folks need to be in withdrawal to start buprenorphine for it to be successful.
Do you have numbers of how many people actually say yes? You know how you have numbers from storage pickup?
Yeah, so we are inducting about 1 person a week. the follow-up has been a big challenge, having folks stay on it. So we currently have 3 people that are following up. This is a very new project. We started in July. So it is still in its very early stages. And Crystal, in a couple slides, is going to talk about our mobile clinic, which is coming soon. And we are hoping to be able to roll out medicated assisted treatment as well as further wraparound services in our outreach as well. So we'll talk about that more in just a few minutes. But I do have some numbers for our stateside outreach outcomes. Over 430 unique participants were served over the last 3 months. So this is over 400 people. And of those 430 people, 133 of them identify as women. 35 rapid community screening tests for Hep C, HIV, and syphilis were conducted, and 50 direct service wound care services. So these are folks that are actually receiving wound care. There are more folks that access supplies and counseling for wound care. These are the direct service numbers. I'm going to pass it back off to Crystal to talk about our mobile clinic, which we're very excited about, which is our newest project.
And in contrary to popular belief, we're not just needle vans. I hear that so much, and that's just like a very small portion of what we do. People actually come to our vans for the array of services that Emery mentioned, which is testing. Majority is wound care services, getting prescription medication, just getting to see a doctor without the hurdles and without the stigmas of going to a clinic. So we heard that, and one thing we wanted to do to respond to that is we got a mobile clinic to provide further privacy and access to these services with a provider or with a mental health therapist or with our acupuncturist in our mobile clinic, which is next slide. Next slide. So this is the mobile clinic. It has 3 little offices on the inside, as well as like a ramp for someone who is disabled, and a little seat for just quick access services. So someone who is interested in coming to get any of our services or speaking to a doctor or speaking to a nurse, getting wound care in the community, which I see a lot of need. We do see a lot of need over there in the hub as well. Folks who are in need of help can come to our mobile clinic and see a provider on call, basically. The next slide is talking about the services. This is the layout. Not the best picture, but this is the layout. The next slide is talking about the services we currently offer at our street outreach site. Aside from just syringe exchange, and these are the proposed services for our mobile clinic that we're going to provide. So every time you see this clinic, there will be a provider on the truck waiting for someone to get services. We also have our providers go out within the community and get to know the community members, the pharmacies, the folks that are in the businesses, and we get feedback from everyone. I wish our outreach coordinator was here right now. He is not, but he is the person that will be driving the van, and he's currently the person who drives our Sprinter vans right now.
And it's one clinic?
This is one, yeah, it's just one. We are relatively close, so we're at Prospect Avenue. A lot of the folks that are in the hub do come to our office or our outreach sites. What we do see is a lot of the folks that we see at 139th Street are more residential versus like the hub. So the folks that we see there kind of don't come to our office, which is why we wanted the need to bring the mobile unit to them as well, so they can be able to access the services.
What do you mean by the folks who are more residential?
They're housed.
Okay.
A lot of our participants at 139th Street and St. Anne's Avenue live in the community. I have been living in the community for as long as we've been up.
I see.
Thank you, Chair. I have a question. So a quick question. Would you say that people come to your facility do not have a primary care physician, correct?
A lot of the times they do not, and if they do, they don't frequently access their primary care physician because of the fear of stigma. Because when they go to their physician, they disclose their drug use, and the automatic response to their drug use is that you need to get clean in order to receive care.
Is that reality? Is that like legal? I mean, I'm thinking that
Honey, doctors are wild. I've had doctors tell me crazy things, so I don't want anything past drug use.
It's advice.
It's advice.
It's
yeah.
not, they're not barring them from receiving care,
It's
but it's
like
the
a
stigma that's
strong
associated.
recommendation.
Connecting it to whatever the issue is, it is because you are on drugs.
Yeah.
Oh, God.
Or
So
just
like if you're
like
going for diabetes, they're like, well, stop using drugs.
Yeah, and you can understand why, right? If you smoke cigarettes, it's really bad on the veins if you already have diabetes, so we can understand why.
Mhm.
But it feels very condescending, and therefore I would never go back.
Exactly, and like we talk about, like the community doesn't like the visibility of drug use. So imagine like someone who is who is homeless and visibly not someone who is looking clean, or someone who has experienced a lot of wounds, a lot of abscesses. There's a lot of fear to go to a clinic or a primary care physician, because people look at you like with, oh my God, how many times have you walked on a train and see someone who is sleeping on a train and you look in the other direction? Our participants go through this every single day. Like, yeah.
What type of metrics do you keep relating to, like, for the people who are homeless, people who are women?
Demographics. We have demographics for all of those things. If you would like a more condensed.
I would love to learn more.
Okay, sure.
Sometimes I have to let you go. Please continue.
I do want to just like as my brain percolates about how we can be supportive in advocacy. The mobile clinic is funded how, or how and through who? What agency?
So the mobile clinic was purchased through our state funders. However, we are looking to secure funding for the operational piece for it.
So that's straight donors.
Yes.
Oh, not like not all major, but you know what I mean. That ain't like
yeah, no.
not Department of Health.
Because this is something that is gonna be basically a second location outside of a location. It's a second stature.
So a satellite.
Mm-hmm.
So I want to ask another question about specialties. You talked about mental health. You talked about other services that are on there. How do you get your medical professionals from? Where are they coming from?
So we have two doctors. They're very well known in the harm reduction community. Kelly Ramses and Bruce Trigg, and we have a physician's assistant, Bill Matthews, on staff currently. And we also we just partnered with NYU, I believe. Yes, NYU, NYU to host some residents who are working in addiction medicine. So we currently have a psychiatric nurse on staff, nurse practitioner. I'm not good with these terminologies. And we have another licensed master of social work in addition to the one that we currently have right now. And our licensed master of social work does mental health therapy.
And my final question is, where are the gaps?
Where are the gaps in what?
In the services you're providing with providing medical services, what do you feel are the gaps that you have to refer out because your clinic either doesn't have the capacity and you want to do more?
Right now, we're pretty happy with the services. We've expanded a lot. We just started providing HIV treatment to folks, but there's only so much that our providers can do for participants. So, for example, our mental health person, his day is all booked up. And if we want to get someone to receive psychiatric help to continue the care, which we don't have, which that is a gap, unfortunately we have to refer them out, and it's always like a 3-month wait to get them in, and they have to see their primary care physician to get referred. Fortunately enough, we do have a great relationship with La Casa de Salud, where our mental health professional is able to, with his license, refer participants to the psychiatric and kind of like not have to go through the primary care. But not everyone is open to those kind of relationships, right? So we have to build them. And that's why we prime our work in making these community relations, coming to the community boards, and so on and so forth.
Thank you, Chair.
Can I ask a question? You mentioned the follow-up being particularly difficult. Do you all have ongoing case management, or is it and like people just get lost, which happens? I'm a former public defender. I lost clients all the time. And if that is the case, yeah, I guess how does the ongoing case management work?
So we do have case management. We have a Ryan White program, which is specifically for people who are living with HIV. And we have case management and harm reduction specialists. Harm reduction specialists focus a little bit more on the harm reduction piece and the continuum of care. So for that, and the case managers work on the social needs of the individual, whether it's getting food stamps, whether it's applying for housing, whether it's getting to the shelter system. So our case managers are available from 7 a.m. to 12 8 a.m. 7. Oh wow, that bugs me out. But they're available all day, either or. For the most part, they are bilingual, all of them, and they work together to meet the participants when they're ready to receive case management services.
Gotcha.
But yes, there is, the times where they are lost to follow up. The more harder piece is our outreach piece when we're trying to connect with folks, because the gap where we're seeing, like on 148th Street, maybe people just once a week, we have to just hope that they keep coming back. For the most part, they have. Like I mentioned, 139th Street, we've had participants for like 30 years that still come. So the rapport and the sense of community is still there, but it changes with person and given what's happening. It's also what impacts is when folks are moved. I don't know if recently you guys know that some stuff happened in the hub and folks were moved. They then become displaced. So
Wait, can you give us contact? What happened in the hub?
There were some cleanups.
Oh yes,
Yeah,
I told you the police came.
So folks become displaced, and it makes the work of all of us a lot harder because we're trying to provide them services, and it takes time to get them comfortable with us, to get them into our agency. So now it's kind of like
You gotta find them.
we're exactly, now we have to find them, and now we have to start again. And the visibility is an issue, and I hear that, but Rome wasn't built overnight, and we can't just expect like, hey, I just met Sam 2 minutes ago. Come with me. Come. I got a spot for you. Sometimes it works, but it doesn't always work that way. It takes, rapport building.
So do you have one more slide you want to go through?
I don't remember.
We
Oh
do
yeah, we
have
do.
one more slide.
Okay.
It's very brief. Our scope of services is the whole Bronx. So we are doing work with other community boards as well, and we wanted to highlight that here. In Community Board 7, we've been working with Senator Gustavo Rivera, as well as other harm reduction organizations, to have a discussion about the neighborhood safety team around the Kingsbridge Grand Concourse underpass. In Community Board 2, we participated in the Bronx AIDS Walk and Health Fair on September 28th, 2024. And in Community Board 5, Satcher has been working and partnering with the Friends of Echo Park in order to advocate for more harm reduction services in conjunction with On Point and DPA as well.
Like my baby in there.
So, first question is, what's the gender of most users? Is it more women or more men in the Bronx?
So no, I love this. Numbers wise, harm reduction was very much dominated by men, because society is ready for the recovering man, but they're not ready for the recovering woman. This is because women have a lot of obligations and expectations, and we're in the South Bronx, a lot of dynamics where machismo comes into it, and women don't feel safe going to harm reduction spaces. Satcher is a little bit different, a lot of it different, where we are a women-led agency, a women-founded agency, and we prioritize women who use drugs. And we do have designated spaces and designated outreaches just for women. For example, today we did participate in the community baby shower in La Central, and I was very happy to see the amount of people who actually came up and asked about Narcan and walked away with Narcan. They cleaned me out of Narcan, and that doesn't really happen at these kinds of events. They happen more so like on our outreach, we get cleaned out, but at the community events, we give out a significant amount. But today we gave out all of it. I don't remember the amount we took, but it was great. But and in addition to this, we were giving out Pampers, we were giving out wipes, we were giving out Plan B, condoms, pregnancy tests. These are all the things that we bring to our women in the community who are at risk, who are engaging in sex work, who use drugs. We also provide panties, bras, tampons, pads, anything that a woman may need to feel dignified, we give to them.
And since there's such an emphasis placed on women, OBGYN services is not something that you guys listed. So how do you handle like the physical needs of the female patients and that you are able to like bring in and start supporting? Or does the nurse practitioner do OBGYN?
The MD and the nurse practitioner.
Yeah, our MD does do OBGYN. But we have a really strong referral network with both SN Healthcare and Bronx Care OBGYN. And we are able to make warm handoffs, which is where like we will go with them to their first appointment and directly hand them off to the care coordinator there. So in addition to having a provider, they also have a care coordinator at those offices. So it's not just, okay, I see the medical assistant, I see the doctor, and now I'm gone. Like I have someone that's going to follow up with me, make sure that I understand what is going on inside of my appointment, and continues that follow-up. When the participant is comfortable, we will also do a release of information so that we can follow up with them as well.
Okay. And
We
then
also
the last
have
one is like
2 doulas on staff. Sorry.
Oh, so you
yeah.
have doulas.
Yes, we have
Oh.
2 doulas on staff.
That's
Crystal is one of them.
progressive. The last question I had is how were the NYCHA sites selected? Because I see Mitchell's not listed.
So because they have their set up, basically their cleaners, we do it by request, and then we basically see what's going on, and we help to train the staff to do their cleanups and collect their syringes from them. But it's not that we don't have the capacity to do all of the NYCHA buildings like the NYCHA has the staff to do it themselves.
So you guys are training the NYCHA maintenance people
Mm-hmm.
on a request basis.
Yeah.
And like is it a higher usage average for people in, because NYCHA is like my thing. Not my thing, I didn't make it, but I fight for public housing. So I'm wondering if there's a higher incidence of drug use seen within NYCHA than in the general public, because you guys were mentioning like a lot of people are housed.
Mm-hmm.
And I know that I have neighbors that are users,
Yeah.
but I'm wondering like how we compare. And if you don't have that number, we can follow up, but I'm just wondering like how do we compare to the general population?
I don't have that specific number, but I do know a lot of our participants come from not Mitchell's, the other one,
Patterson?
Millbrook.
Oh, Millbrook.
Millbrook. So that is why we actually go to Millbrook. There's there was for a while a large visibility of syringes, just on the outside.
Yeah, I know we've had some overdoses.
Yeah, so that's why we're in Millbrook, and a lot of our participants were congregating in that area.
Just for time purposes, drug and policy lines. I don't know if you want to say something.
Yeah, I mean, I can talk a little bit about the
and
landscape.
and then we could just have a general conversation since I think all the providers would have spoken. Did I miss somebody?
Cassia.
Oh, Cassia Network. Okay, sorry, we'll get there. Okay.
I do have questions for On Point though.
So I'm the New York State Director for Drug Policy Alliance, and so we do policy advocacy at state level legislation, and also we do city level work as well. And so I'll speak specifically to overdose. Where's
Right there. So okay, the owl is looking at you.
Okay.
The status you could see.
It could be one.
Yeah, so there you go.
Okay.
Perfect, thanks.
Okay. I think it makes most sense to speak specifically about where overdose prevention centers are in the political landscape, since that's the kind of hardest service to just say, we're just gonna open this. So at the city level, New York City obviously supported the opening of On Point's overdose prevention centers 3 years ago, and has since, I think a year and a half ago, committed to opening 3 more by 2025. And we have consistently heard from New York City that they remain committed to doing this. And we know that other political factors are always in play. And so at the state level, as you said before, we have a governor who has not yet voiced support for overdose prevention centers, and that signals some hesitation at the city level. And so while the city is trying to move ahead with a really kind of more comprehensive plan to address overdose deaths, part of that plan is being hampered by the state not being willing to move in concert to kind of allow funding to flow, to create kind of the clear legislative pathway so that the city feels like we're aligned here, we're protected, we're like on the same wavelength. And so we've been focusing most of our advocacy at the state level to get the Senate and Assembly members to better understand overdose prevention centers. With On Point, we have worked to get a lot of elected officials to tour the facilities, to demystify what they are, to kind of understand them as more than just kind of like what the headlines often shape them as. And what we consistently hear from our state legislators is that overdose prevention centers make a lot of sense, and they're always thinking about what the constituent feedback is going to be. And so like one of the most powerful things that they are looking for is as much vocal support for overdose prevention centers as they're going to get vocal opposition. And that doesn't necessarily mean more people, it's like the noise. And we know that more like when people are unhappy about something in the community, they're likely to be more loud about it. And so it has taken, like part of the work is to kind of hear from community members, like be in spaces like this where, right, we're actually kind of providing, this kind of information so that community members can decide to reach out to their elected representatives. And I would say that that's true at the city level and also at the state level. I think it's really important for council members to be supportive and voice that support. We have seen that New York City is willing to move forward without the state. I think it's just a matter of there being enough of a drumbeat and alignment between city council members, the state representatives of that area, and also like support and alignment from other partners on the ground, including police precincts. To ensure that there's going to be the support on the ground to help the services be successful.
My understanding is that the two locations, the On Point locations, were done via executive order by de Blasio. I only say that, sorry. Only because I'm concerned about city support as well. I know Eric Adams, last month presentation, has toured the facility. I only say that because I'm a little bit concerned about how supportive the city is. Last month we printed articles, and I know that there's like 56 state lawmakers. Natalia Fernandez is one of those supporters.
Diana is too.
So, when you say that you think the city supports, I mean, like, and I think, what do they support opioid prevention centers or
Overdose prevention.
Overdose prevention centers. Sorry, I want to call them safe injections, and I know I'm not supposed to use that word. Okay, language matters. I mean, do you think? So let me just step back. One, as policy committee chair, the goal is to write letters in support or against whatever our board position takes for these issues. And I do hear you that letters of taking a position helps support these things. But I wonder if the city is really as supportive as we think. Why do you think they're supportive?
They've said they've been supportive multiple times. They they released what's the name of the plan? They released a plan about a year and a half ago for a Healthy New York related to mental health and substance use. And so in that plan included the expansion of overdose prevention centers. It seemed like at that time they were hoping to use funds from the New York City's bucket of opioid settlement dollars,
but they can't do that.
Them. And then they've since gotten clear direction. At that point, they hadn't gotten such clear direction or such clear response from the governor that she was not going to okay that. And since then, she has rejected recommendations from the state opioid settlement fund advisory board, which also, for multiple years has said we should be funding these kinds of spaces.
What about the lieutenant governor? Brad, have you guys tried with him?
I mean, what we're getting is a governor who showed up as someone who supported our work, talked about family member who overdosed, talked about the importance of.
Coco said this?
Oh yeah, she talks about it often. So she talked about a family member who overdosed and died. Her nephew overdosed and died, and gave a lot of us on the harm reduction side the perception that I actually used words that an OPC would have been a good option for him. And then later on came back, I guess about a year ago, talking very differently about how treatment would have been a better option.
So it's real.
The fact for us is not either or. So I just want to bring up two things I forgot to mention that are very important. One is when people say you should send your participants to treatment and detox, 100% of our participants have been to treatment and detox. And when I say they don't work, but what we know factually, I know attorneys love facts and community board members love facts. Factually, most of the people who go to treatment and detox have to go multiple times, right? That's just the nature of the process. And punitive approaches look good on paper, but don't work. The other thing I really forgot to mention, very important about when, I like to say when you open an OPC in this area, not if, is our relationship with the NYPD. And our relationship with both precincts where we're located is so important to the work we do. They've become partners. They've participated. Instead of arresting the very same people they used to arrest, they now walk over to the organization, even knowing they have drugs on them and they're going to use drugs. And that's a large part of what Jason is responsible for doing and has taken on even before it being part of his responsibility. An outreach and public safety team working closely with the police on, years ago, for those of us who are a little older, we knew what a beat cop was. Now a beat cop lasts 3 months, which is really unhealthy for a community. So it means our team is always interacting with new police officers. And that is actually, we're learning more, a very new tradition in communities of color, which should actually be the opposite, right? Where we don't get the same police officer for a long time. So we have to keep going back. Jason goes and speaks to roll call at the police departments. We have a very good relationship with not only the two precincts, but our contact at One Police Plaza. And I have to tell you, that's one of the most important relationships we have.
So yeah, we were trying to, we as a community board, make sure we get reports from them to see how, they feel about the existence and help guide our decision. So I'm glad they're doing that. I was just on a panel about reimagining police, and I know I just know as a public defender that simple possession is not getting people anything.
You have your DA, like the Manhattan DA, who is committed to supporting overdose prevention centers. That's a big deal because what it means is the district attorney is telling the local precinct where you open, if you bring people in for these kinds of crimes, I'm not going to prosecute. I'm not going to move the case forward. So instead, get them to the harm reduction organization. That's a big, big step in supporting harm reduction and the services we offer. The other thing I forgot to mention, very important, is our, again, harm reductionists and treatment providers for many years didn't work well together. That has changed. Our relationship with treatment providers and detox providers has become key to the services we provide. So it's really amazing to see that relationship growing. I've been in this work for over 32 years. So I've seen the process. I've been involved. When we first started, we didn't know we were doing harm reduction. We were folks like Joyce and some of us were out there doing things for people living with HIV, not realizing this is the beginning of harm reduction. Cleaning syringes in a bucket in a shooting gallery, the beginning of harm reduction. So watching from a very different relationship between harm reduction and treatment providers to becoming a much better a force working together to serve our participants.
I just want to let Acacia Network speak before.
Can I follow up on the sites?
Okay, sorry.
So the city committed to the 3. Have they announced metrics as to how sites would be selected in that report? And based on your understanding, which communities would be benefiting the most from 3 new centers?
There have been a lot of conversations in the Bronx about need and kind of at the community level and also from elected representatives and looking at data. So there continue to be a lot of conversations that come back to or sit with the Bronx as a place of need. The city's plan, I think the goal was real and aspirational, so it didn't get into the specifics, and the
Right.
city was still signaling to the state, we need clarity so that we can actually move forward with more specifics about where and who and which providers and all of that, because funding and kind of like that clear alignment between city and state in the legislative process felt important, I think, to the city. And I mean, also not for nothing, we're in a big political moment now, and unfortunately, services are at the whim of election cycles. And Senator Gustavo Rivera holds the bill that would authorize overdose prevention centers at the state level. And we were often told, as we were advocating for the bill this past legislative session, like it's not going to pass in an election year, right? Like come back next year. So we are going to come back after November.
Here's the thing, there's always an election, right? Next year's mayoral election, so there's always election. So what election are they talking about? Just
This
presidential?
November.
The presidential?
There's a,
every 2 years?
right, I think there's a heavy focus on the congressional races and how that's gonna shake out for New York. There's, to some degree, focus on other.
Do you guys do voter registration?
Yes.
You have the bill number?
Yeah, I was gonna say.
Yeah, it's gonna get a new number this session, but right now it's, on the Senate side, it's 399A. And it's called the Safer Consumption Services Act.
Introduced by Senator Gustavo Rivera.
Yeah.
And do you accompany the voter registration with civic education?
Yes, we just
On like
launched.
which policy and legislators are actually supportive of the type of treatments that you guys?
Well, they are nonprofit organizations, so they do have rules about what
So
specific.
they can't endorse, but
We-
you could say there's a housing committee, right, which is the way that we do it. We say this is the group of people at the housing committee that would dictate the budget that affects the work that we do. And then have constituents actually develop those relationships.
Yes, we currently have a civics group. It was started by Michael Brady. Yeah, so we have a civics group, and it's now being run by one of our case managers.
Excited.
That is where participants are being educated about government.
We had to start very big with the civics group.
Yeah.
Like what are civics?
Yeah.
What is voting? And
like who
now,
represents you.
yes.
Yeah.
Now we're getting into like the nitty gritty of it's early voting. So let's learn about the candidates that are up for election and what does that mean.
And then in that education process, you would highlight like, Gustavo, who is an ally, right? So like if this is your person, he has been supportive of this kind of work in the past.
Yeah.
All right, sorry. Acacia Network, sorry.
Yes, hi. So, I'll repeat it for the owl. Maybe I could just move right here?
Yeah.
Come on in.
So hi, I'm Arian Saxton, at the
Oh, no,
Acacia
it's-
Network, but I oversee the Bronx Opioid Collective, which is about 15 plus organizations that work together in the harm reduction space. So that includes Stature, that includes On Point, Boom Health, the church, I can't remember what the
Immaculate Conception Church.
Immaculate Conception. So organizations that are trying to resolve the issue of the crisis that we're in with the opioid crisis. And I know we're pressed for time, so I'm just gonna be a little bit quick and turn it over to Melissa. But this is a really wonderful organization because we bring together all the different ideas. And so, for example, last month we were actually able to talk with all of the members. We have a monthly meeting, which is next week, Wednesday, and we got to really hear the different perspectives of what is happening because recently there's been the news decided to focus on our area. We're situated over on 149th, and we do outreach throughout the South Bronx. I know you might ask this later. We are funded by Rafael Salamanca, and we've had this grant for 7 years at various levels, and it's really exciting. So we do outreach, street outreach in the community, picking up syringes, providing sandwiches, supporting the community members with what they need, as well as partnering with organizations like Columbia to do wound care, etc. Melissa, you can probably go more in depth on that. And then right now we are, sorry, I'm going so fast.
No, calm down.
I think I'm like, you work a mile a minute, so. So The thing that we're really excited about creating right now is we're creating an app. And this app allows us to create, so it's like Citizens app meets hotels.com. So in terms of Citizens app, you have the option if an outreach worker, any person that's a part of our organization, sees something, they can say, we've cleaned it up. We've cleaned up these syringes, and then they can also pinpoint an area and call on maybe another partner of the Bronx Opioid Collective to come and clean it up. And this allows for us to have the level of understanding what is the actual situation where we're at. I know that data really drives the numbers, drives the need, and drives the funding that we want and resources that we need. And so we're really excited to do that. And this also allows us to see and track what we're giving out, whether it's syringes, whether it's Narcan trainings, etc. And then the other side of it is also more of the hotels.com, where you can access services through the app, where it's going to allow people to say, we need to make a referral to Boom House for a detox bed. And then you can see in real time how many beds they have. Because the power of this collective working together, it now allows us to be able to see with transparency, like how much availability is there, because sometimes you have to go through this process, working in this harm reduction space and social justice space, clients, follow-ups, all of these things. Sometimes an individual will get exhausted of being told yes and then not getting a service. So, or they may not want to commit because they think they won't be an option for them. So this kind of allows us to decrease that lead time and ensure that they can get the services right then and there, right when they need them. And then it also helps us with tracking for data. And then it also allows us to build out a map of all these organizations participating in this work. Where are the hot spots? Where are the cold spots? Where are we actually identifying the need and resolving the issue? So we're really excited about that. That will probably launch early 2025, but I'll turn it over to Melissa.
Before you turn it over, who is helping you develop the app?
We partnered with an organization, Builder AI, and they are building it out for us based on all of the needs that we've identified, based on all of our conversations with organizations, not only the organizations themselves, but the outreach workers, just so that we know that this is a user-friendly app on the phone and also on their computer, so that when they download their data, it can be available not only it's a CSV file, it will be available for whatever organization's computer system they have.
Thank
Do you
you.
have a name, do you have a working name for the app, or you don't know what it is?
It'll probably be Bronx Opioid Collective app.
That's a long name.
But that it's internal facing for members of the Bronx Collective. It's not external facing for members of the community.
Yes, it's going to be internal because, as we know, this can be used for nefarious reasons later on down the line, and we want to make sure that we are as HIPAA compliant as possible, so it doesn't collect client sensitive information. And we also want to make sure that as we're building out and thinking about these hotspots, we don't want it to be a situation where it gets in the wrong hands and people can decide to now target those areas to whether it's prosecute, clean up, or sell drugs. So,
Thank you.
Thank you.
Yeah, so I think for me, what I think is really important about this project is the fact that it's harm reduction and non-harm reduction agencies working together to do the work. I think that it's really important. I'm sorry, I'm just gonna come.
Come on down.
Yeah,
Yes.
for the owl.
Welcome.
So I think it's just really important to just, highlight that, that the harm reduction and non-harm reduction agencies working together. Acacia Network, La Casa de Salud, we're not a harm reduction agency. We've learned a lot from working with the harm reduction partners that we have. It's been a really, really great experience, right? Just trying to bring everything that we can to the community, right? And try to clean up. One of the things that Arian had mentioned was the wound care, our partnership with Columbia University, right? One thing that we noticed when Hurricane Maria hit in Puerto Rico, we started to see an influx of individuals with very extensive wounds, more extensive than what we were usually seeing, right? That birthed our little pilot that we had over by the wound care, by Burger King, where the Columbia nurses would come out for 8 weeks and they would kind of assess these wounds. They brought out wound care kits. They were teaching the community how to keep the wounds clean, things like that. And then over time, over the course of the weeks, we saw the improvement of the wounds. So from that birthed the wound care training with Oren and Columbia University, and now they're able to train organizations across the globe on wound care, and the importance of.
Acacia Network is just drug treatment facility, right?
So Acacia Network is more than just a drug treatment facility. It has pictured as the umbrella, and then we have about 110 affiliates under us. But Acacia Network has a robust array of services. They have detox, they have rehab, they have residential services, they have community health services, HIV programs, hepatitis C programs.
But your facility, you guys have a facility in the hub, no?
Not yet. So
okay.
there was some talks about opening up a crisis center there in the hub, but I don't know if that is still going to happen. We do have our La Casa de Salud clinics located throughout the Bronx. We have 5 FQHC health centers in the Bronx, one on 149th Street. We have our Ramon Velez Health Center that's co-located with our methadone and outpatient program. Then we have Clay Avenue. So again, we have an array of services. Acacia has a big housing arm, so you will see that little tree all around the place. So again, they have an array of services, but for this particular project, we wouldn't be able to do what we do if it's not for our partners, right? So again, harm reduction, non-harm reduction, it's really, really important. It's really important. It is.
I want to thank everyone, obviously. Sorry. I don't know if the team has any fuller questions. I have some. Yeah, I have some as well. Just to do next direction. So I feel like I'm relatively new to the community work. It's my second year, but the attorney in me is always what's next steps? How do I do some work? So besides hearing everyone speak. So there's some big policy things that are going to be hard, which is getting the governor to change her position in the election years. But I wanted to know, what are some small things you think the community board can take a position on or help facilitate to make some differences? Obviously those ideas have to be presented to the bigger board. There's 15 board members who have to take a vote on things. But I hear some policy about, at least for me, getting the governor's position to change so the state and the city can be aligned and funding can flow better. Last month's presentation, I know some of the, at least on point facilities are small, right? The spaces, the need is great, but the space is small, and working with some of that funding. Satcher, I heard you guys on WNYC, that's what I wake up to, about so many pushbacks you guys have been getting. Some of the things I want to just ask is an idea percolating is, I know there's a lot of, I feel like there's not enough street outreach, and you guys are all over. I learned last month, the hub, the Bronx is big. And so once a week stop bys are just not enough, right? So one of my dreams is that when the hub made the news, NYPD was there the next day to man the area. And I don't know if there could be, for example, a street team dedicated just to one place, if funding was a magic wand, okay? If we could, someone would just man the hub, for example. I don't know, that's an idea that could actually work. I don't know.
So currently we actually have our street outreach team that is actually stationed in the hub from 10 to 1 o'clock. That is something that just started.
10 a.m. to 1 p.m. every day?
Every day.
7 days?
5 days.
Okay.
And all of our organizations are there at different times. So we try not to, for the best of our abilities not step on each other's toes, because we want to make sure, okay, if they're here, we're gonna go somewhere else. So throughout the week, our focus throughout, you know, a lot of our outreach teams is the hub. One of us are there, you know, 5 days a week, doing.
So if you guys
services.
have duplicative goals, right, in the same area, I think it's important for us to understand like who is, because I know On Point also comes, right? So who's on the hub days and times? Because if we have 5 organizations showing up Monday through Friday, and the last person is leaving at 6 o'clock, then that means by Saturday and Sunday, I don't have support services or a presence. And I think, to Delorne's point, like if we're gonna be looking at short term, that could be a short term ask of like Salamanca and Diana, right, to make sure
And
that.
also our state people too, right? Albany can come in and throw some money at this problem if it's just a street outreach team, you know what I mean? That's like,
We do have I'm sorry to interrupt. We do have a schedule set up with Department of Health so that there's no, to prevent that overlap.
Also, you
Department
is that where he's from?
Yeah.
Also, he's looking for the schedule, okay.
I know that,
So, yeah, if the board could get that, I think that'd be really helpful.
okay, that'd be helpful.
And then also
Aaron-
like understanding like the physical needs of this schedule, right? And what needs to be added to the hub. Because I think the idea of moving people from the hub is inappropriate, to put it whatever way. But I know that that's been the push, right, to do these cleanups, and that's not working for the community.
I know some of that comes from our bid director,
Yeah.
who's obviously representative of the businesses there. It's not like he himself has a problem, but he's responding to business owners who state that this is a deterrence for retail. Go ahead. I'm so
I have
sorry.
just a few things. So Third Avenue Bid does work closely with each of these organizations who are doing the outreach. They've also done like the Narcan trainings with us and also help with syringe cleanup. Granted, they are focused on the business aspect, but they are really also very excited to focus on cleaning it up so that they can bring in more businesses. So that's one. Two, in terms of the calendar, I believe I have everybody's calendar in a shared Excel spreadsheet. So at our Wednesday meeting, I guess I can hold some space and just check in with all of the organizations just to make sure that calendar is right, and then I can send it out to you guys so you can kind of see the layout of who's actually there at what times. And then the third point, I lost it while I was talking.
I wanna respond to a couple of things. One thing is the community board. It is rare in any community board in the city to support an OPC. I can't even imagine another one doing it, and I don't know them all. But I can tell you, it'll be shocking. So I think if you have, and I know you didn't say you do yet, but if you have full support of your community board to talk about this, right, Tony, I think this would be powerful, because one, it'll shock legislators, city council members, et cetera, would be, oh my God, like an entire community, or, the vote. The community board is asking for this is very rare. So it's a powerful tool. The other thing is the outreach, an expansion of outreach or more outreach and everything. I really hope you see that as temporary, because I will tell you that our team, who's, I'm sure everybody here will say their team does great outreach and public safety. The pieces, when they come in and say, outreach and public safety isn't enough. We need an OPC there. So I'd offer you to be strategic around those asks, right? If you're going to say we want more outreach, we want that to be temporary until you open the services that are needed, right? What I'm hearing, and I haven't seen it myself, is where the hub is now needs a brick and mortar full program organization, right? And when you think of the services, I don't know what you were referring to. What was small? What were you referring to? The
So small, I mean,
OPC or
Square
the?
footage.
Well, when I say small ass, things that we think could potentially pass now, right? Because
No, but when you said size, you said something about the size.
because because we learned last presentation with your
Smaller than an Old Navy.
Yeah, not smaller. It's just that there's a lot
You
of
guys
people.
are outgrowing your space.
Yeah.
Who said that? Tell me their name. No. Yeah, in a lot of ways we are in a good way. At the same time, I just want to like also look at what's a good size for an organization in providing these services. And so, for instance, even with the size we are now, like I would love for both our OPCs to be bigger. We're seeing a few hundred people at each site every day. That's a lot, right? So managing the space also, how you manage the space really matters as well. I just want to really again emphasize that if you're looking to answer the larger question of brick and mortar, these guys almost every time I see them, they're saying we need not only an OPC, but an actual service, a full service organization, a full service provider. And, I will somewhat speak for Joyce. That might be dangerous because Joyce is pretty tough. Yeah. But I'll say something about courage of opening really matters, right? And I know, if Joyce was given the opportunity to open somewhere, it wouldn't be a matter of trying to get legislation approval, and those things are wonderful. They need to happen. But for an example, we opened without any of it. Mm-hmm. We had what you said, right? The mayor supported us opening. What we did to answer that question is we got the approval of the mayor's office, worked with the two precincts where we're located, got enough cover where I thought was enough, and we opened. That's it, right? So many of us know if we go through a legislative process, which would be the best thing, we're talking years, potentially. It'd be great if this is the non-election year where it happens. My biggest concern around any of this is if someone gets an opportunity to open, is the organization willing to take that risk? And again, Joyce, if you please call Joyce after this until I put her out there. But I knowing Joyce, she would open.
Yeah,
right?
I heard WNYC, there was
right?
like pushback.
Good.
I mean, again,
right? So it's so, and I want to also watch things around pushback. Their pushback is very different, right? I'll say it like this: if Satcher, Joyce had the same situation we had, they'd be open already, right? They would be open, and that's a big difference between waiting for tons of approval versus addressing the issue and ready to open right away.
I just want to throw this question out there as we. Oh, sorry.
I think it's also like we want to open in the hub, but the financial part of it is a very big piece. It's we looked at places in the hub to open to have a second facility, and it's very expensive.
Yeah,
very expensive.
Speculation. One of the things the last thing that I wanted to remember was the temporary solutions that you had mentioned. While the brick and mortar is necessary, one of the things that the Bronx Opioid Collective brought up last month that they really feel like is so necessary is the fact that there are not enough evening and late night services. When you're doing all of this cleanup during the day, people who use substances are not 9 to 5. They're not going to stop because it's 4:59. They're going to quit. So I think it's very imperative that when we're thinking about funding and temporary solutions, having that funding be for opening services that are late night and extended hours, because lots of organizations, you can't survive. You can only pay your employees from 9 to 5, and you don't have that opportunity to have security and all these other people that are necessary to have a brick and mortar open late nights. And then the officers may clean up during the day while the cameras are on, but at night they're going to move right back in. So I think it needs to be a focus on that if we're talking about the funding sources as well.
Thank you so much for that. I do want to say one thing is, again, there's 50 of us, you've only seen a few, is combining of services, you guys. I know you're saying harm and not harm, like working together. A lot of our members, and when I say board members and just community in general, feel like they call it poverty dumping, well, now the hub has become so expensive, but that we get an overwhelming amount of drug treatment facilities, harm reduction, that's harm, supportive housing, just a lot of things that what people feel, brings a a large group of undesirable people, lack of a better term. And so I was telling this to people, even my supportive housing. I sometimes feel like the community doesn't want not one additional thing, that we are holding the burden of a lot of the city's needs, and that is unfair to people in this community, and that it might be diminishing the quality of life in the community, right? So as a result, a facility that, if we can, I know this is for people who work in the industry, this sounds like unheard of, but if we can reduce one, or, if we can combine, services, and therefore, let's just say we have 15, we're not going to add to 16, but we would still have 15. We just add an OPC of some sort. Like, Satch, you guys are already here. You obviously would need another brick and mortar for an OPC, but things of that nature, I feel like could be strategically persuasive, that we're not inviting another organization. We're actually just combining organizations or combining services. I don't know what you guys think about that as actual service providers in the area.
And following up on that, is Samaritan Village a part of the conversations?
Yeah.
Because I think they have the biggest presence in the hub.
Yes.
Right? So I've never been, right? So I don't know why they have such a large presence, and yet we're still having this crisis, which makes me raise questions about how is their service differing from what you guys are doing? And then does it benefit our community to have these additional kind of spaces that are not addressing from a holistic perspective, right? The community that we're talking about. So while I think that the footprint needs to be something that the community can manage, I think it's also important to have an internal conversation in the group that you mentioned that you're all in about what are the success metrics, right? Because when we talk to, and I have friends that are still battling addiction, and it's a very lengthy and costly process for the taxpayer specifically, right? Because they drag out addiction rehabilitation for so long in some of your partner spaces. So it's like, I think for the community to understand the value of the space, the footprint needs to be acceptable. And then a lot of the things that you mentioned about, Sam, how much waste reduction happens, and then the cost saving to the community, right? But I think those are going to be integral things that, like, the larger board, where we have some folks that can be a little more, what's the word? Not progressive,
moderate,
conservative, right? So we have a lot of elders that are not in these committees, that can be very conservative, and this argument of like poverty dumping is going to come up.
Oh,
right?
Especially our homeowners. I mean, I'm a homeowner, but still,
Yeah,
they really are like, oh my
The
God.
homeowners and the elders are going to want to hear, like, how am I benefiting, right?
If they want to hear at all.
If they want to hear it at all. And I think the benefits of the lower, from 13,000 to 1,000, the 165,000 people being served, the 5 million units, like, these are the things that the coalition really needs to start looking at. And then you also need to start asking yourself internally, like, if we have, like, I know at least 4 sites around the hub that are Samaritan branded, do you guys need to, like, hold each other accountable, right? Because the community that is not being served in these spaces is holding us accountable to say, well, why do you have these 4 spaces there? Now you want to add another one? Why is that remaining, right? And to the cost, Samaritan has real estate, right? So it's like, how likely are those kind of, like, honest conversations to happen in the space? And if they're not happening, then I think they need to start happening, because it can't be on board members as individuals to, like, justify the cost for the larger community. We have to listen to what the larger community says, and these are the arguments that they're raising, right? So I think behind all that, is also this question, that's been lingering since Sam spoke about the decrease in the white community not being reflected in BIPOC communities? What is causing that? And I know that's not gonna be a simple answer, right? And the reason I'm asking is because drug use in our communities looks like BIPOC people, looks like us. And if people are using this rhetoric of like deaths are going down or people are transitioning out, we're gonna have to answer like, no, we aren't seeing that, right? Because we're BIPOC, and we're not seeing that because of these reasons as well. And again, you don't have to like go in, and it can be something that you guys follow up on. But I think from a community perspective, like these are the things that are gonna come up. Well, addiction's down. Why do we need another place, right?
Anybody can feel free to
We have
answer.
4 Samaritan villages, which is something I say when I'm on the VX2. Why are we not seeing a change? Why is it getting worse in the hub, right? And I know it's like a very like holistic response, but she had gone first.
I was like,
You're right. We can answer this in many ways, and it's a difficult answer. But I will say, I think one thing that's important, just in how we understand and talk about the issue outward to others, is that we're in an overdose crisis, right? So like rates of use across demographic groups are relatively even. What is not even are the levels of risk. And so the risk factors for overdose death are stable housing, levels of not being housed, criminalization, a history of criminalization. People who are recently released from incarcerated settings are 40 times more likely to die of an overdose death as other people.
Underlying health issues.
Underlying conditions. A lot of the people dying at the highest rates are older Black men. So a lot of co-occurring disorders, long-term chronic health issues that are not addressed over time, lack of primary care, right? All of the other social determinants of health that we talk about when it comes to other social issues. So it's all levels of risk that we're seeing. What's interesting in looking at the data that New York City just dropped today, the rates of overdose death among white people did go down 9%, which is about similar to the rates that have gone down across the state, largely in white communities, whiter communities. And so like really we're talking about structural racism, which is not one solution. It's like how people are criminalized, the encampment sweeps, like how people are cleaned up off of one corner and then displaced from care, how people are connected to other networks of care, and it's all of that. And so I think, this is one piece of the conversation, and there's so much more.
And that's an important conversation to have with your community board, right? Because we get why they don't get it. They're responding to what they see.
Mm-hmm.
Hearing this kind of conversation is enlightening for people. And the importance of us as Black and brown folks not to participate in those systems. Right? This is, I don't want to get into this now because I'll go off for a long time. But this is this is why we said there's no drug war in this country. Having drugs in this country is profitable. It supports modern day slavery, right? It supports modern day slavery for me. I'm gonna speak for Sam Rivera right now. Is the criminal justice system. Look who's in it, look who feeds it, right? So can you imagine the DEA clearly says three cartels are bringing all the drugs into the United States. 3. So why are they still coming in? And there's a system involved. I don't want to get into conspiracy theories. It's not a conspiracy theory. This is based on fact. The reality is for our people to do everything possible not to participate in that conversation, which is difficult, right? Because you guys brought up something important. This is what they see. This is what they're experiencing. Yeah. But when you hear what Tony just had to share, it's like, oh, wow, I didn't think of it that way, right? Because this is what we're fed. And as oppressed people, we participate in that. Our own people, right, going against our own people is what we do well. So it's important, and I was going to say before even Tony said that, is when you come into a larger meeting, is to bring that conversation, bring researchers who will give you the facts. And even if those facts go against some of the services we provide, we need to hear them too, right? Like as providers, if you're not open to hearing where you're falling short, which is really what you were talking about, and answering that question. So if we have this many millions of dollars, whatever that number is, going into every service you provide, why do we still have a problem? And as a service provider, you better be able to answer that. That's what I would say. You better be able to answer that. And if you can't, then that speaks to something else, right? That speaks to concerns around maybe an organization just providing enough to stay in existence, all those things that people say, and how real is that? But community members deserve an answer to those questions.
I know it's late, so I think we have to end this meeting. I think this is a great conversation. I can just, is it possible just for Bronx Opioid Collective, when we talk about extended hours, are you saying like potentially funding an organization to stay open longer, right? Not just adding a new late night organization, right?
Yeah, I was talking about funding for the organizations that are already on the ground to just stay open longer and doing services evening and late nights.
Yeah.
And weekends.
Yeah, because weekends, I was like, you guys don't think people do drugs on Saturday and Sunday?
There is a weekend team. They're not here.
I was like, what's Saturday and Sunday? Okay, I think I want to thank I think this was very informative. My next points are just to my community board members. I don't know where Health and Human Services is going next, but perhaps I should invite Samaritan Village
I think that
to a meeting. Whitney sits on both Health and Human Services and policy, so we don't need to have joint meetings. Whitney can report back to us in policy, and then we can work on other policies as the new session in Albany is up and City Council is up.
One other question.
And
I swear to God.
it can't be a compounded question.
I
Cannot be a
swear.
compounded question.
I swear.
Okay, go ahead, Ramona.
How did 126 and 179 get selected?
Where we were located. That's all.
So you guys have
listed.
Yeah, we were already located in both. And basically, again, and this is for harm reduction providers, we were chosen because we were ready and had the support of our landlords. And there were a lot of other factors.
I did not know that.
Yes. We weren't,
The overdose prevention center is really just a room they added to their facilities.
Yeah, something like that. It was something I would say, if you've been to Statue, you'll see they're ready. Oftentimes harm reduction providers
Breaks my
are
heart.
ready to open. What's that?
Every day.
It reminds me,
We
and
see
it
it every
breaks
day.
my heart. I see it every
I'm
day.
sorry to remind you. So even like for us, we were already had a space identified, and once we got that call, we immediately made it happen. And so I think most harm reduction providers have that at the ready or close to it.
I also want to say that On Point did invite us to do a tour, Health and Human Services.
It's $50 a person.
And, Health and Human Services.
If they didn't tell you that, when we get there, we're gonna swipe you.
Thank you so much, everyone, for your time. I really appreciate it. This was very informational. It was very it was important for us to hear this on the Health and Human Service Committee as well. But we're gonna take all this information, we're gonna take it to the board, and hopefully we can be able to have that communication and also have that conversation going as well. I'm also speaking as a parent. I have a 10-year-old, so I know what it's like when there's parents coming out of school, picking up their kids, and they see that on a firsthand. It's bigger than just a community. It's bigger than that. So I appreciate everyone, and thank you so much. Motion to adjourn?
I can motion.
Okay, Ramona, motion second?
I second the motion.
See how quick you got
All
that?
right, any discussion? Any names? All in favor? Aye. All right. Good night, everyone.
I was ready this time.